Okay, call the meeting to order for the Board of Health, March 19th, 2025. Welcome to everyone. Thanks for coming. Our agenda, start with approval of the last meeting's minutes, and I think we'll have several meetings.
We do. We have June, September, and December. So, if anybody needs to reread them, I'm sure December's were not read yet. So these are all available here for anybody that wants to reread them before they approve. David, would you like a copy too? I got
I
you.
wasn't at any of the meetings, so I really can't tell you whether they're
I know.
proper or not. But
Well, I'll give you guys each a copy.
you got them?
Yes, I have. Yeah, absolutely. Yeah.
I approve the minutes of the last three meetings.
A second. Okay, there's a motion to approve the minutes for June, September, and December of 2024. And there's a second. All in favor, signify by saying aye.
I
Opposed? Motion carries. Okay, old business. We have a couple new board members filling in vacant spots. Jamie Burns. Welcome, Jamie.
Thank you.
And Mayor David Cates. Thank you, sir. Appreciate you guys stepping up and joining the club. The next thing will be the approval of the new Board of Health meeting dates and times for the next year.
So we try to do our Board of Health meetings every quarter, and I like to kind of put them out for everyone, and nobody was here last time for these to be approved. So if you guys all want to just look at these dates, I think a lot of them have on their calendars. The only one that I had to switch was June, because normally we do the third Wednesday of every month. June, we are at a training on that third Wednesday. So if those work for everyone, then those can be approved.
And they'll always be all at noon, correct?
Always noon right here.
Okay. Any problems with those dates? We have June 11th, September 24th, and December 17th.
Move we approve those dates for meetings for 2025.
Is there a second?
Second.
Okay. Any more discussion? Motion and second, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Thank you. New business, the Board of Health Track Dash Confluence Conference scholarships are available. Do you want to go into that?
Yep, I will. So Confluence is the like overarching umbrella that they formed to combine Montana Public Health Association, AMFO, MIHA. MIHA is the environmental part of public health. So what they did this year for their Confluence conference that we go to, that they bring everyone, is they're doing a Board of Health track. And in this Board of Health track, they're asking everyone that is on Board of Health members, chairman, whoever, to kind of come and see like what this looks like, what the training is. There is scholarships for it. It's Tuesday, April 8th and 9th. I think, yeah, it's done, starts April 8th at 10, done by the 9th at noon. but yeah, please take a look at this. Like I said, there's scholarship if you want to. It's in Helena at the Delta. If you guys would like to come, we're really encouraging all Board of Health members because what they're seeing is we're obviously roping a ton of people into Board of Health, but it actually consists of so much more than just like an advisory board. And I don't think anybody kind of realizes that until obviously we get to a situation where we have to make those tough decisions. And so that's just kind of what they're trying to do a little bit more training on what Board of Health is. But yeah, it's available for any and all. So that is an opportunity you guys would like to do. Do you just want me to keep talking, Jim?
Yeah, is it at
Okay.
is it at the Delta or where's it at?
It is at the Delta.
Okay,
Yep. Yep. So it's the same email that I sent you.
Yep.
That I forwarded on to everybody too. So, should be some really great information. I'm hoping that I can hop in on a couple of them and kind of see what they have to say, but, yeah, it's a great conference. Shannon and I are both on the planning committee of this conference, and so this is one that we're really excited about.
okay, so how soon ahead would somebody need to let you know that they want to go?
It's actually on the,
Is it? Okay.
yeah, and you don't have to let us know. You can actually, there's a link that
yeah, I
you
was gonna
can,
say, I think there's a
in the
link.
email that you can go and sign up.
Cool.
And I can resend this to everyone's email too, if they just want to click the link and stuff, if they're interested, I'll just drop it in an email today. So that way it's a little easier for you guys to register if that's something you guys want to do.
Okay.
The scholarships are super easy to register for if that's something that you guys want to do. Confluence is the same place that I got my scholarship through to go to Nashville for the National Board of Health Conference.
I got the scholarship to go to
MPHA.
in Minneapolis.
Yeah, so super easy applications. Yeah, if you're available, I would love to see you guys there. The other thing is we are going to roll out our community health assessment. I know we talked about this a couple meetings ago. It's kind of been ongoing. We're ready to roll. So we have partnered with Logan Health and the Rural Health Institute out of Bozeman. They are actually the ones that are creating the side for Logan Health. And then we worked with the state for our side. What we did is we took our CHA, their CHINA, put them together. And I don't know what it's called now, but we're going with just the CHA. And so that will start rolling out the 30th. I'm gonna put an article in the paper to let everyone know kind of what this community health assessment is. So here's kind of some advertising we're doing. We're gonna do QR codes. We're doing, hospital is doing mail out to their participants, but we also have paper forms that will put anywhere and everywhere for participants that do not know how to scan a QR code or would just prefer to have the paper copy. In this, we have demographic questions. We have a lot of mental health questions. Yeah, please take the time to go through this. We're hoping that it won't take a ton of time for individuals to fill out, but we really are in need of this information to be able to determine what this county needs.
Yeah, between the two entities, we got it down to 44 questions is all, which actually is really great, but they're very inclusive and go over every health need really that you could think of, so.
Yeah, so those will be rolling out. We'll keep them out for 3 weeks. And then, once the Rural Health Institute will be the ones doing the data, the collecting of the data and stuff. And then by this summer, we should be able to have the assessment ready to roll. And then we can look at an improvement plan after that to see what kind of programs we can search for to bring into the county. So that's kind of one big thing for us. Starting this process actually will start us in the process of becoming nationally accredited, I think it is. So, which we're able to get more grants and stuff if we're accredited. So this is just our first stepping stone. Anybody have any questions about all that stuff? I'm gonna put them everywhere. You'll see these signs everywhere. Paper copies at the senior center,
Library.
library, like anywhere and everywhere. We would just love to have individuals' answers.
And
My-
they're mailed out.
Yes, yep. So,
Not to the entire county. They take a selection of, patients that go
Mhm.
to Logan Health and they tabulate however many they want to send out and then they mail out. So,
we will be taking these to like, Heartview Post Office, the Heartview School. We will be taking them to all, Depuyer, all the little towns that we possibly can put them in, Valier. Yeah, we're just gonna throw them from the sky and everybody just gets to scan.
Sure the wind's not blowing.
Right, yeah, so we're hoping that we can get a pretty good result. Teton County just did theirs not too long ago, and they actually had, I think, like 71 participation rate with their answers, so I was pretty excited for that. The other thing is we are going to be closed for that week of that training. Not all of us are going. Casey is being trained in
youth aware mental health.
yeah, so she'll be in Bozeman that week. Shannon and I will be in Helena at Confluence. And then the days that we have to be closed, Tassie will be at a WIC conference. So unfortunately, we just are all over. Yes, yeah, crazy week. So we will put it posted that we will be closed for that day and a half. And then, of course, obviously, if anybody needs to get a hold of us, they always can. And if there's emergencies, the state just calls Shannon's cell phone anyway.
Yes.
So, DES position, Jim.
The position is still open. We've, interviewed a few candidates and are continuing with more scheduled interviews. So if you know anybody that would be good, that position, we'd sure encourage them to, apply. And, I think to me, the interesting thing about this position is we're obviously a smaller county. And so whether that's a full-time position to get someone for that position, we made it full-time, but then there's all these other things to do, fire warden and other things that are involved with that. Or, that could be put with that. And so it's not a position that's gonna be boring. And there's lots of different things to do in a day. And the mapping, our code red, for our alerts, that needs to continue to go on. And then there's always grant applications that need to go out for various entities in the county, and that position has a lot to do with the grant writing too. It's, I really think for the right person, it's a self-starter. It would be huge. I mean, and the pay is not bad. In my opinion, it's certainly ranks higher in the county pay schedule anyway. And I'm told the county pays well comparatively for Montana. So anyway, if you know anyone that would like to at least have more questions about it, please have them give us a call.
How many applications have you had?
3.
3? Okay. So you are getting some response.
Yeah.
That's good.
Is there any specifications that you're like looking for? Like, do they have to have a degree in anything or like past services and emergency management? or
That's
anything
all
like
looked
that?
on as favorable, but not required.
Okay. Perfect.
Okay, so health department report.
Well, I'll just keep talking.
There you go.
So the Near Initiative 11 grant, just to let Dave and you know, Jamie, that it's a $250,000 grant that is being granted to 8 counties and 2 tribes, for a period of 2 years. And we had 2 options to apply for it. There is the system level initiative side, and then there was the community health worker side. We decided to apply for the system level initiative because what we got from the input that we did get from the community is they would like a lot of training. So what this is kind of going around is behavioral health. This is following up with the behavioral health crisis grants that they're putting out for different counties. This is also working with our planning grant from the North Central Crisis Coalition that we started. So with this grant, if we were to get it, we will know April 1st. Again, it's $250,000 for 2 years. And what I'm looking to do is form a coalition that can have a lot of input, because that's a lot of money for this small area for 2 years. And I really would like to get systems in place that could be sustainable for mental health for this county. Whether it's, Teton County is running a pilot program where they have iPads in their cars and they can just connect to 988 if there's a mental health crisis, or whether it's we send officers or whatnot to train the trainer. And so they're able to train new employees coming in when it comes to crisis diversion and EMS and hospital staff. And if we were granted that money, I'd like to look into something like a community telehealth room, whether it's maybe, I don't know, in the library, senior center, somewhere public where an individual can go in, do their counseling session and come out, and nobody's like, oh, they were at the counselor. So if I could find someplace like the library upstairs or something, my thought would be to put like a locked panel lock door on it with a key code. And then they would have to get the key code, obviously, from the health department. And then in there would be a screen, a couch, like just everything you would need for a telehealth session. What else was on my thing? A ton of education, ton for the schools. I'm looking into some culturally appropriate mental health stuff for Up in Hart Butte. Oh gosh, there was just so much to this grant. We kind of knew that it was coming out the beginning of the year. They kind of told us, because it's a first come, first serve. So they're scoring them as they're coming in, these grants that I submitted. But also what we're thinking too is with the North Central Crisis Coalition, a lot of us are applying for those grants. I know Teton County is too. And working those resources together, like making that big regional thing that maybe, we can put money towards the same thing and build something bigger for mental health. But on that line, with the North Central Crisis Coalition, we did hire Terry Kendricks, who is going to be going around, and she is an independent contractor who we hired through Missoula. And what she is doing is she is our Crisis Coalition coordinator, and she's going around and explaining to everyone in our region, these are the counties that are in our region, why we need to kind of form together for mental health. And then on the back here, it's showing in the last year, it is the last year, Tom, for these numbers that we talked about yesterday, that 988 calls. So if you guys want to look at these, kind of get an idea of what Conrad's got going on or Pend Oreille County, I should say, for mental health. Sorry, Brian, you'll have to share. So I am meeting with her in person tomorrow. And we'll kind of have a little bit more conversations. She's wanting to go to all of these counties. So if you guys know someone, or David, if you would like to have a conversation with her about different things, because we're trying to involve all the stakeholders in the county, because obviously if a crisis happens with mental health, there's so many people in it. And so we're really trying to get that all on one level. The other thing is we are getting Smiles Across Montana to come in July and August. They are willing to do the community. They are bringing a trailer and 2 dental hygienists. Same thing like with the Blue Cross Blue Shield van. They bill your insurance, whatever your insurance doesn't pay, they cover. So we're really going to try to put that out to everyone.
And they'll do full screenings and cleaning.
Yep, dental screenings, x-rays, cleaning, yeah, like
Apply fluoride, varnished kids.
Yep.
everything.
So we have them for 3 days, each time they come. So we really want to try to get as much as a community as we possibly can. I also have the Blue Cross Blue Shield band looking at St. Vincent's has a mammal bus that works the same way. They can do mammals in 15 minutes, like 15-minute increments. Same thing, if your insurance is billed, it doesn't pay, or whatever's left over, they will cover. So I'm really trying to get that here too. So we'll see if we can get that. It's all you now.
One thing that's not on there is we're doing vision screenings again for the community. We have the 23rd of April, we're doing all of Conrad schools, Conrad Christian School, New Miami Colony and Midway Colony. And then Friday, the 25th, we're going to Valier, Kingsbury Colony, Ponderay Colony, and Birch Creek Colony. We are still working to try to find a date that works for everybody to do Heart Butte, because we usually go up there as well. It is a Lions Club program, actually, it's the Toole County Lions Club that has the machines that we work with. So they're coming down to do that. And then at the end of the month, we're doing kindergarten screening. Thank you, kindergarten screening. So I'll be there doing immunizations, as well as the Blue Cross Blue Shield Care Band also has one of the machines to do vision screening. So they'll be doing vision screenings at that instead of just reading the chart. It's a little more accurate. Influenza this year is high everywhere. It actually, the first time since 2020, is above COVID numbers. So it is definitely out there. I do still have immunizations. It's not too late. It is late in the season, but it's not too late to get immunized with influenza vaccines. So if you need one or know someone, let me know. I'm more than happy to do that. I did have, it was actually interesting. Someone's influenza got sent to the state to see what type it was, and it was actually H1N1, which was the swine flu. And it was the 2009 variant that was here that had, so I don't know if that's why the numbers are so high and spreading so quickly, but it's definitely here. Measles, there's outbreaks everywhere. The big ones are Texas and New Mexico. Texas was up to 200 and some the last time I looked, and they have had 2 deaths related to the measles outbreak. They had a child and an adult both die now. It's close to us. I think it's Washington and Alberta are the closest places that it is, but it is around. There are plenty of people vaccinated, but there are also plenty of people who are not. So we're encouraging to everyone and anyone to see if they're up to date. Adults, it was, you're born prior to 68, I believe, is the year. You're considered presumptively immune to it, but anything after that, we need to check and see if you are, if you're going to be, especially if you're going to be traveling, that's important. But, and then what else do we have on there? Oh, the continuing resolution, which just passed, thank goodness. It was a continuing resolution to make sure the government still helped with Medicaid, WIC, SNAP benefits. And when we made this agenda, it was still moving through the process. So I was really hoping it would go through. It did. So it will still cover this fiscal year. It will be reevaluated in September. But luckily we're covered at least until then. So we'll learn more from that. FEP, which is Public Health Emergency Preparedness. We are redoing some of our plans that I will bring to the meeting our next meeting in June. And then we are doing a highly infectious disease tabletop exercise with the state. This is the one, like David, you said you would come to, and then I ended up having to change the date. So I do have the flyer there on the table. June is when it will be. And encouraging anyone that would like to participate to let me know. We will get, it's all over Zoom. The state puts it on, they help, and it goes over a highly infectious disease, and then we can go through our plans and make sure they are where they need to be. And if not, it shows, it's a good place to show us we need to make some changes before a truly highly infectious.
Yeah. So yeah, town pump grant back in October, November, I had applied for a $5,000 town pump grant. We got it. So what I did was I put that money towards, doing little, we call them weekend backpack food bags for the kids up in Heartview that are not getting their food, during the weekends, that they might be a little strapped for that. So we did 94 bags the first time. That was back right after our last meeting in December. And then Amy and I just took up another 100 bags up there, and we figure we have enough money left over to do another 2 rounds. So we're hoping to get those kids through summertime anyway with that, with a couple more rounds of that. I've been busy working with Amy for the CHA coming up. I have to go to the high school this afternoon. During that week that we're gone in April, they're having a parent night, but they did ask me to borrow, it's called a hidden in plain sight room. And what it is it's just, you basically set up a teenage room, but you have a bunch of different things that kids can hide paraphernalia and alcohol in, and parents have to try to find. One of the things, for instance, is like a little key fob, but you flip it open and it's a drug scale. Water bottles that can come apart, they can hide their stuff in there, different things like that. So I'm gonna go up to the school and show them kind of what I have, and then they'll set up the room for that. I think it's April 8th or 9th that they're doing that. And then on my tobacco side, the big thing we're just kind of watching right now, there's a Senate Bill 390, and they're hoping to add vapes to the Clean Indoor Air Act. So we're kind of watching that to hopefully make sure that it's got good momentum and that vapes will be added to the Clean Indoor Air Act, and we can get those out of public buildings as well. So lots of stuff. And then, yeah, my YAM training in April to do the Youth Aware Mental Health. So I'll hopefully get to go into the schools and help with that when I'm training that.
Okay. Any questions? If not, we'll go to the sanitarian report, and Corinne's not here, but did she give
Yep,
you the
he sent
info?
it to me. So, Association of the Food and Drug Officials, offered excellent web training in January. The 2 that she found most interesting were master freeze drying fundamentals and compliance for dietary supplements and food ingredients. She has had a person inquire about licensing requirements for freeze drying foods for the public. Home style freeze dryers can be an issue when it comes to the freeze drying, because the time temperature controls for safety. So TCS foods, such as meat products, I'm not sure what that means. But also, she's been out getting food establishment inspections completed. OPI requires that the school services are inspected at least 2 times each year. And she does have 1 inspection done for the 3 school kitchens already. As far as DEQ, waiting on outcome of litter community decay ordinance violation on a property in Brady. She did recheck on the property January 29th. It had appeared to me that more vehicles were parked on the property and no effort was being made to clean up the property. The mobile home was siding and the insulation is blowing off in the wind. She did take pictures and provided them to Sherry Lennon, the county attorney. Septic systems, she has 1 permit for a new home west of Conrad. She did have a request for another new septic system east of Conrad. We will again be dealing with, I think it's non-dig, which takes into account the nitrates and the specific conductance of groundwater. There is no groundwater in this area. Portable water is provided by Tiber Water Public System or hauled from the Conrad Water System. She has spoken to Rep. Jones to see if there could be a rule change to take out the account for these areas that do not have accessible groundwater. And then the EPA Class 5 injection wells permitting, still no decision. Scott Brown of Montana Salinity Control said that DNRC will not fund the baseline groundwater sampling program for water wells, springs, etc. in the Valier area, and that could potentially be advisedly impacted by the injection of high-strength wastewater. This is frustrating. I have recommendations from both Scott and Russ Liu, Montana Environmental Lab, on what residents should test for and what they should test for and the cost. And if they want to submit baseline water supplies on their own. So I have not a clue what that all means. But yeah, I mean, I feel like it follows exactly what you talked about last month, so. Cause I know there was a couple of them that they were talking about, the non-dig water stuff, so. Yeah. All I got there.
Okay. Is there any other business to come before the Board of Health? You're sure? Last call.
I don't think so.
Only
I'm
comment,
done.
I'd make a comment on this.
Yeah.
about This.
Yeah, please.
My neighbor in Wisconsin is EMT.
Okay.
And so is his wife. They spend about 90% of their calls are people like this.
Yep.
Mental health.
And of those 90, they end up taken to an emergency room. Or this is in Madison, there's 250,000 people. So he spends his nights calling the same people a lot of times. We're having a crisis. And the other 10% he helps college kids that don't know how to drink yet.
Yeah. Well,
So they get
yeah.
sick and their friends call 911.
Mhm.
So he said, we're up there going, this is not a 911 emergency. So between those two things, I understand what you're saying.
Yep.
It's just-
Well, and the reason why, like I said, we did the whole, we did those 8 counties to sign on for us is that we all filter down to either Great Falls or we're going to Kalispell, like we're going somewhere bigger. And all of our counties are finding that the only place we have to hold these individuals is jail. And then we're just starting the vicious cycle all over again.
Yeah, jail isn't gonna.
Yeah,
fix their issues.
no. So, and not only that, it's causing the county so much money, like,
Yeah.
because they don't need to be there, they're just, I mean, it's just a lot, so. That's what hopefully, if we get awarded this grant, we can really start working on some programs that can get them to do some preventative measures before we get to that crisis.
Yeah, I know he said they're really kind of stuck. They don't know.
Yeah,
There isn't an easy answer.
no, there truly isn't,
On any scale.
nope,
And the problem.
yes,
Yeah, well, yeah,
yeah, so.
sounds like it.
Anything
Some
else?
Interesting story.
Mhm. For sure.
I, again, thank the, new members for joining and also want to thank the former members that served so well and now for various reasons are no longer able. Appreciate it. And if you feel like you need more information, that's what Amy's for.
Well, no kidding.
Give the big bucks, right?
And Shannon, but, no, I think we have an awesome, health department. And, we're very grateful for everything you guys do and the board also. So thank you much. And we'd entertain a motion to adjourn. We're done.
I so moved to adjourn.
Okay, all in favor? Okay, so our next meeting then is going to be June, correct?
June 11th.
You mean
Noon, high noon.
And Jim's cooking that day.
Yes, it will probably be a rainy day in June.
Oh, man, one of those
So you
3
like
day
Yeah.
smokers.
Yes,
Leftover.
yes,
You
yeah.
gotta wait for it to save. You just stop recording.
I just forget, we're being.
So what you say?
I know.
Yeah.
Cuts down on my smart remarks about 80%.